Hi, I'm Tammy Fawn-Lander. I'm an obstetrician and gynecologist here in the Des Moines area. I've been in town since 2008. I'd like to shed some light on an important topic. Postpartum depression is considered the most common complication of childbirth in the United States, occurring in about 15% of women. Here at Unity Point Health Des Moines, in 2020, there were nearly 5,400 deliveries. According to the statistics, that will mean that over 800 of these moms suffered from postpartum depression. Women can have a wide variety of symptoms, both physically and emotionally, when they're suffering from postpartum depression. For instance, women oftentimes will not be able to sleep even when they have the opportunity to sleep. It's certainly normal and expected for a postpartum mom to be tired, but it is concerning when she isn't able to rest even when the circumstances are that she should be able to. Other things that she can experience are palpitations, even chest pain or shortness of breath, and irritability, increased sadness, being overwhelmed, crying, feeling inadequate. These are all common symptoms that women may experience. Certainly if there's any concern for maternal safety or safety of the newborn or any other children, emergency treatment needs to be sought out immediately. Any risk factors for postpartum depression? Any woman with any personal history of any mood disorder, whether it's related to a prior pregnancy or the most recent pregnancy, or even aside from pregnancy, is at higher risk. Also family history. We are a product of our genetics, and certainly for a woman pregnant with her first child, if there is a strong family history, she could be at greater risk for experiencing this as well. We know that there's a lot of physical risk factors as well. There's significant chemical and hormonal changes that take part during pregnancy and immediately after birth, and those can factor into postpartum depression. Pre-existing health conditions like thyroid disease, hypertension, and diabetes also can play a role. If a mom had a high risk or complicated pregnancy and or delivery, or having issues with breastfeeding, those can also factor in. There are multiple social factors that can increase a woman's risk for postpartum depression as well. Currently, due to the pandemic, we're seeing, significant social factors related to support. Teen parents, impoverished people, those with babies in the NICU, and those with increased stressors during the pregnancy, such as a move, a job change. Those can all significantly impact a woman's risk for postpartum depression. There can be multiple consequences of postpartum depression, especially if it's untreated. There can certainly be relationship strains within the home. Studies show that partners of women who are depressed postpartum actually have increased risk of depression themselves. There's also concerns for the mom's ability to breastfeed if she's having struggles with postpartum depression. We have to look for the maternal self-cares, which can be adversely impacted, as well as those of her newborn and or other children. Women who are depressed tend to not take care of themselves. There's a higher risk for issues with maternal and infant bonding, and actually the infant's neurodevelopment down the road, and the cognitive capacities down the road as well. Sadly, maternal suicide is the leading cause of maternal death postpartum. It's important to know that postpartum depression is treatable. All women are issued a postpartum depression screening questionnaire before they are discharged home from the hospital. Those deemed higher risk for complications may warrant being seen 2 weeks postpartum instead of the traditional 6-week postpartum visit. We also screen routinely for postpartum depression again at the postpartum visit at 6 weeks. Some women who are higher risk may already have follow-up established with their mental health care provider or therapist. Treatment also includes multiple factors, such as having extra help at home, Everyone needs their village of support. We have to focus on both the physical and emotional supports to the mom postpartum. There are also several support group options. Many of those are virtual now, so it makes it more accessible for some women to be able to communicate with others online. There's also the potential need for medication. Your OB provider or your primary care provider can assist you with a plan of care. Oftentimes this requires referral to a mental health specialist. Fortunately, here in Central Iowa, we are lucky to have behavioral health urgent cares. Certainly for dire situations, the emergency room is the place to go. It's so important to know that you are not alone, and as an OB provider, we want you to reach out to us. Help is on the way. Please give us a call if you need help.